During his time as president, Bill Clinton adopted healthcare system reform as one of his top priorities. The healthcare system was, and still is, extremely complex and left many Americans uninsured. Clinton recognized the grave errors embedded within the system and sought to reform them, both from a place of morality and a place of political gain. He sought to create some form of universal coverage for the country. Clinton established a task force consisting of Hillary Clinton and Ira Magaziner to help develop a new plan. When the plan was released, Bill expected bipartisan acceptance from both parties. However, he was quite wrong. The bill was criticized on many fronts, including for simply being too complex. Other politicians worried that it would cost too much, especially when Clinton was being pressured to lower the national deficit and reduce spending, while also making as few tax increases as possible. This was a problem he had been warned about before making the committee. The bill was not well received by anyone. Conservative politicians believed that the costs were far too high and that government regulations for health insurance should be limited. They essentially believed that private insurance should not be meddled with and that Clinton's universal health care was an expensive overreach of power. Liberal politicians believed that this system was not helpful enough. Clinton's proposal was to enroll Americans in health maintenance organization. This program maintained the existence of private insurance companies but inflicted more government regulation. The liberal politicians wanted a single-payer tax system present in Europe and Canada. This type of system was highly regulated and had the government take responsibility for all citizen medical costs. Moderate politicians wanted a version of the plan that was less extreme. The private insurance sector vehemently protested the vote because it threatened their system of profit making. Most average citizens were wary of such a drastic change, especially those who already had insurance. There was a fear that insuring more people would hurt their own coverage. Overall, the issue was highly polarized and resulted in political gridlock in the House and the Senate. Clinton was unable to create a bipartisan policy, and therefore the issue was never resolved.